Hi there, I'm Dr. Kirchner, and in this video I'm going to be showing you how to administer medications, pills to your cat, colloquially known as pilling your cat. So this is our participant. This is my personal cat, Knoley. She tolerates things really well. And our pills today are just little pieces of cheese, just for practice. So there's a few techniques that I'm going to be sharing with you today. And there's the simple all the way to the complex and some variations that I'm going to be covering today. So what we can do is, my favorite technique is you take your cat. You can either do this seated or standing. And there is this little crest above their face, right where their chin and cheek is. And that's a really good landmark for being able to feel where you want to put your hand. And what I do is I'll grab the pill in one hand, and then I'll grab their face at that landmark with my other hand, and then arch their head all the way back. Some cats will open a little bit, other cats will not open as much. And then with my middle finger in my other hand, I'll open her mouth more, drop the pill into the back of the throat, close the mouth, and do a few strokes on the throat. And what that does, when you see her licking, that means that she's swallowed it. And then there you go, that's technique one. Okay, so your next technique is for cats that wiggle a little bit more, that are a little bit more difficult to hold, is you can have them on the floor. And what you can do is you can kneel and you can back their rear right up into your knees, kind of so they can't wiggle. And then you're gonna find the same landmark on the face, and then you're gonna take your pill with one hand, and you're gonna open up the mouth, similarly as we just showed, and then open with your middle finger again, pop it in the back of the throat, rub the throat, and there you have it. Good job. So this next method is for cats that are even a little bit more difficult than the previous methods, where you're trying to do the pilling and the medicating. However, they're moving their arms, their head, they're trying to squirm, they're trying to run away. So this is another technique that has worked out well for us. So with my partner, Michelle here, what she will do is she will get closer to the cat, and by putting her body over the back end of the cat, this can work better on tables or countertops. And then she will restrain the paws and the chest, pulling the cat closer to her. And then I will be working directly with the head. So when I am approaching the cat, Michelle will give a tight hold and a firm hold, while I then find those landmarks again, arch the neck all the way back, and as you can see, Michelle's hands are in front of the cat. If the cat is acting up a little bit, that is normal. And then sometimes it just takes practice where speed is key. So again, open the mouth, pop the pill in, close the mouth, give that rub, and there we have it.
We're going to be using a towel to wrap the cat in, also known as a kitty burrito. So you want to put your towel kind of lengthwise this way, and put your cat kind of in the center. You want her to lay down. You're going to start with the first side, kind of come up above the cat, and then with the other end of it, kind of swoop around the rear end so they can't back out. And you're going to keep this kind of snug up around their neck area so they can't get their front feet out, because that's typical of them wanting to kind of swat away anything coming at the head or face. And you're going to, again, keeping it snug up around the head and neck area. And usually the towel's long enough, kind of bring it up and around like this. And then you have them secure in your burrito.
Okay. And then when your cat is in that burrito position, you can come around, feel those landmarks yet again. Open up the mouth, put that pill in, close the mouth, rub the throat until they start licking their lips, and then there you have it. So there's some frequently asked questions. Obviously, Knoley is a really good participant where this is not your average cat. Your average cat will try to flail, and I did make it look a lot easier in the videos that you might be experiencing at home. Also, I do this every day with patients, so please do not be discouraged if it's challenging at home, as it's normal and it takes a lot of practice to successfully pill your cat. One of the most frequent questions that I get is, what if I put the pill down the windpipe or the trachea And I want you to be rest assured that that's not going to happen when you're arching their head back and opening their mouth. Instinctually, they know to protect their airway. So their trachea, the entrance to the trachea is going to close, and then as soon as you close their mouth, they will naturally swallow, and that will go into the esophagus. So no worries there. Additionally, questions are, when do I stop? When do I stop killing my cat? When is it too challenging? So if your cat is completely worked up, where they are not themselves, and if they're squirming, or if they're panting, or if after being in the burrito, they lay on their side and they have completely given up, or there's risk of physical injury to yourself or the cat, and it's just not going well, you can give a 15-minute break and try again. Alternatively, we are always here to help. If you have any questions, you can give us a phone call. You can reach out to us via Pet Desk, and we are more than happy to assist with answering questions, or even bring your cat in for those circumstances where cats will not be tolerating medicating at home.
Good job, Knoley.
And then pop that pill in, give that rub, and there we go.